Welcome to Health Quest. I'm your host, Linda Frizzell, and today we're going to get to speak with Dr. Marianne Hink, who's been practicing internal medicine for the past 16 years in Sedro-Woolley. She recently transitioned to a new position as Medical Director of Clinics for Skagit Regional Health. Welcome.
Thank you.
We have a fun topic we get to talk about today, don't we? The MyEClinic, correct?
Right.
Which is like a virtual way to go to the doctor.
Right.
Great. Well, before we get to that, why don't we spend a few minutes and you can tell our audience a little bit about you.
Okay. I'm originally from the Bellingham area and then went to Wisconsin for 5 years to go to the Medical College of Wisconsin and came back to Seattle and did my internship residency at Virginia Mason and then came up this way.
Wonderful. And then did you came right to Sedro-Woolley after that?
I did, yes.
Wonderful. So we're here today to talk about the new MyEClinic that Skagit Regional Clinics has rolled out. Maybe you could give a basic description for the audience.
MyEClinic provides an excellent opportunity to improve access to care to a provider. The provider is either a nurse practitioner or a physician. Anybody in Washington State can access MyEClinic. You can access the clinic through FaceTime, Skype, or regular telephone.
Okay, so you literally could pull out your phone, dial the number, and then do you put a credit card in, or what do you have to go through to get to see a face at the other end?
The site will prompt you for some basic information as far as what condition you are referring to. You do enter a credit card number as well as some basic insurance information.
What about Medicare or Medicaid?
Medicare is covered. Medicaid and TRICARE are not at this time.
Okay. So can you diagnose anything over the telephone or FaceTime, or is it just certain basic things?
Common conditions that are covered are respiratory symptoms, urinary symptoms, sore throat, pink eye, cough, cold type symptoms.
And then do they write a prescription at the end of the conversation?
They are able to prescribe common lotions for rashes, antibiotics if they are indicated. They do not prescribe pain medication at this time.
Okay. So after you've had your conversation with the healthcare expert at the other end of the line, and a diagnosis has been made, is there a referral then for follow-up to one of our clinics, or is there a next step, or is that just the end?
There's several avenues that this could take. If they're not comfortable, if the condition is too complex for the e-clinic environment, they will refer you to urgent care or possibly the emergency room or your primary care physician. If a diagnosis can be made, then a prescription can be sent to a local pharmacy.
Okay.
And then you will receive a note as well as your provider.
Wonderful. Well, I can hear a lot of parents probably dialing up when they have the earache in the child or the pink eye or that type of thing. So it will be great, for access, I think. We have a clip, don't we? Did you bring a clip with you that shows how it works?
We do today.
Okay, let's roll that.
Hi Carolina, this is Aaron Oss. I'm one of the NPs with Karina. It's nice to talk to you today. What seems to be the problem?
I'm having some pain in my sinuses.
Okay, well let's see what we can do to help with that.
Get a medical diagnosis, prescriptions if necessary, and feel better soon.
What you see here is a common interaction between the provider and the patient.
Wonderful. Now, what is the cost of a visit through the MyEClinic?
The cost is a flat $40 at this time.
Okay. And is there anything else that the public needs to know about the use of MyEClinic?
The service is available 24/7, and there's excellent communication between the MyEClinic and your provider. They will provide a note that will go into the electronic health record.
Wonderful. Well, thank you, Dr. Hink. I think this is so exciting that it's the new technology and allows that 24/7 access, as you say.
Great. Thank you.
Thank you. Thank you for your time. Stay with us, and we'll be right back.